you were a proponent of ozone therapy, and ozone is a reactive oxygen species, and our white blood cells produce a reactive oxygen species, so they're doing the exact same thing. So why don't you tell us a little bit about ozone therapy and what you know about it, and what you think it could do for people that are late stage suffering from this, from any kind of viral or infectious disease for that matter.
Yeah, so the medical ozone therapy has been known for quite some time, probably at least 100+ years history of successfully treating primarily infections and some other diseases. So we know ozone in our society is something that we use nonstop to disinfect the water, the air. So, but however, from the medical standpoint, this country is a little behind the rest of the world, especially countries like Germany and Russia and Brazil, where ozone have been used for a number of years successfully, very safe. The clinical use we know that started during the First War, World War I, when the doctors were using ozone to treat the wounds. It was before antibiotics area, and the ozone was very effective. And then when antibiotics came in 40s and 50s, that slowly pushed back the natural antibacterial and antiviral treatments such as ozone. However, to some point we got lucky with recent waves of viral infection that people start coming back to the idea of the ozone as a universal treatment for any infections. For the ozone, it doesn't matter what kind of antibodies, what kind of particular microorganism you have. It actually successfully kills almost all pathogen known to human beings, including virus.
How is it applied clinically, and how do you protect against damaging healthy tissue with ozone? It's kind of a loaded question because white blood cells protect healthy tissue, yet they kill pathogens as well. So I imagine it's fairly similar, but I'd love to hear what you...
Yeah, so it's a good question. There is so many mechanisms that ozone works. However, from that standpoint, ozone therapy stimulates the body towards the homeostasis by creating a mild acute oxidative stress and activates certain pathway, to be specific, an RF2 pathway. It's, by the way, the same pathway that activated during the exercise and the fasting in the human body. So it's a universal railroad towards the health and self-balancing of the body. So among some other mechanisms of action, the ozone therapy is able to increase the body's natural antioxidant production, enhance oxygen metabolism, which is a foundation of every cell to have oxygen and energy metabolism at a healthy level, and certainly does modulate the immune system as well. From practical...
Yeah, so there used to be an old-fashioned way to apply ozone, but now there are some more sophisticated ways to get ozone physiologically into the system.
Yeah, so there is a many ways to deliver ozone to the area of interest, so to say. And as an interventional pain specialist, I've been using ozone for the herniated disc of the back, for the joint issues. We use successfully for infectious problems such as Lyme disease. And there's a different ways to do that. The most common in a classic way is so-called major outer hemotherapy, developed back in 50s and 60s in Germany and Russia, even before that. That basically, when we withdraw some blood volume, about 200 cc from the human body, and ozonate it with medical grade ozone and re-inject it into the vein, and that even small amount of ozonated blood, 200 cc, which is about 5, maybe 10% of the general volume, start creating the healthy reaction beyond just the ozonated volume. It starts creating those adaptive reaction of the organism towards the homeostasis and modulating the immune system. It's almost in a way, it's almost a vaccination as well. if you can use that word in the broader spectrum.
It's a vaccination of the innate with the innate immune system rather than the adaptive immune system. But it's
correct.
It still would have to be looked at. The only thing is the adaptive immune system sort of lingers, so you have protection for a longer period of time, whereas this you have to reapply. Have you personally done ozone therapy?
Yeah, I've been doing ozone therapy for the last about 20 years, including all kinds of applications, including infections. We recently have, I think, 2 or 3 patients that we found to be positive with the COVID-19, and without extra measurements of the human response, like we talked a few minutes ago, the treatment turned out to be very successful, at least from the clinical standpoint. None of the patients developed any, cytokine storm, so to say. None of them ended up in the hospital. The treatment was relatively safe and quick, and the people end up having a very mild course of the COVID-19 infection.
What do you think about doing ozone therapy on someone who that might test positive for antibodies but doesn't have clinical symptoms? Would that mess immunity up, or would that actually be helpful?
Absolutely not. Ozone is indicated as a universal balancing modality. So we use a lot for general disease prevention and well-being.
Okay.
A lot of patients coming actually for intravenous ozone, maybe once a month, once a couple of months. They have great energy level, great resistance to the immunity. So ozone, like pretty much everything in medicine, is even more effective when it's done without any acute situation. So absolutely, ozone is a great modulator, great balancer, and improve the immune system and modulate the immune system in the right way.
In America, is there any insurance coverage for an ozone treatment?
Not at this point. None of the insurance company recognize ozone treatment, just like almost any integrative or alternative treatments are not recognized by insurances, probably due to the lack of the local studies, which seems to be very expensive if you want to do it in the right way with FDA. And that's the reason why we're developing more science at this point. We're trying to do more studies, apply for grants, and bring the attention of the medical community in this country to this very safe, very effective, very inexpensive treatment.
Well, I learned something significant today. I already knew that, people with cardiovascular disease, respiratory diseases, pre-existing conditions die at much higher rates, 10 times even more than healthy people. And so that should be our primary goal, because the flu vaccine for 2020, the flu vaccine was only like 56% effective against the most common strain. So that's only 56%, whereas being healthy protects you by at least 90% against the novel coronavirus without any vaccine. And then vaccines may not be that effective because we're dealing with the cytokine storm. But what I didn't realize is that ozone really is an immune augmenter, like intermittent fasting or like exercise. And that's new information for me. That's fascinating and valuable information. It's a shame that we can't get this thing more wide. Are there home ozonators, or this is something that has to be done clinically?
Well, there's certainly, I recommend to some patients, especially out-of-state patients, certain setup that can be done at home using ozonated sauna, ozonated water. It's the generator that you have to use for human body is different from the generator that we use to ozonate the air and the water. And the main difference is related to the source of the air, because the ozonator, the home ozonators, they use the air to create the ozone. And as we know, air contains many other things, including nitrogen. And the nitrogen is not a good thing to be used for the medical purposes. So the medical grade ozone generator used the medical grade oxygen without any impurities in the air, and that creates the main difference in safety.
Really good point. Really valuable information. Is your clinic still open under the so-called lockdown?
We're using mostly telemedicine, so we're trying not to bring the patient physically. We're reopening actually first week of May, which is a good news. And certainly we'll use a lot of modalities such as ozone to modulate the immunity, kill the virus, and make people healthy in general.
Right, I love it. Great information, Dr. Artamonov. Thank you so much for your time.
Absolutely, it's been my pleasure. It's very important subject of cytokine storm, and I hope we will discuss it further, Doc. Thank you so much for having me.
Absolutely.